Hi everyone, welcome to my channel. Welcome. How are we doing? So today we'll be discussing about this is for the pregnant mamas, the pregnant women in the house. Yes, we'll be discussing about low PCV. So when you go for your antenatal checkup and they tell you that your blood is low, your blood volume is low, your blood level is low. So what did I do in my own when I had my own baby? When I discovered I had low PCV, I did so many things. I was worried. And mamas, one thing is, don't take your baby's health, don't take your own health for granted. Immediately they tell you that you have a low PCV, I think the next thing you should do is to just look for an alternative or how to cure it, because according to what I've read, according to what I've heard, it is so dangerous that it might even take out your baby. It is harmful to you when you want to give birth, especially maybe the what I heard is when you're about to give birth, you start bleeding. Sometimes I wonder, you bleed and you're in need of blood. Where is that blood coming from? But anyways, I'm not a doctor. I'm just here to tell you what I did when I had that issue. I think my volume was about my blood volume was about 27 or so. So and the doctors were like, this is low. I have to do something about it. I have to raise it up. I have to so and I had the normal blood volume that a pregnant woman should be about 33. Yes. So mine was 27. We even had cases that some are even lower than that. But what did I do? I seek advice from women, from people that have done it, and in fact, what they told me then was it will make you prone to disease that can take out your baby. Yes, before you know, malaria can just strike you from anywhere because you are not guided. You get. So we cannot overemphasize the issue of this blood, and I think to some extent, I don't know, stats, I can't say, but 50% of pregnant women always are in need of blood, or their blood is always low anytime they are in this pregnancy stage. 50% of Nigerian women, I can say, because I can count how many times I've met with a pregnant woman and she will be complaining about her PCV. I can, yes. So I'll just be mentioning like three things I did to cure this thing. And mind you, it is very important though. Please take it serious. It is a serious issue. So you have to be really, really very intentional about it. Because the things I'll be listing here for some pregnant women that can be very picky, it will not be easy. But my dear, you have to do what you have to do because you are pregnant already and we want you and the baby to be safe. So you just have to do it. I know it will not be convenient, but you have to do it, really. Because I'll be listing some things because they tell you that when you are pregnant and you have low shortage of blood, it might open you to heart attack. Yes, bleeding, bleeding, bleeding while you're about to give birth. So you really need to take it serious. Yes, you need to take it serious. It's a serious issue. And as time goes on and while you're at your pregnancy stage, the more the baby grows, the more you need blood. The more you need blood as the baby grows, you need more blood. You need more blood. So it's not something that you just rely, especially if your doctor is always telling you that you have anemia. It's not something that you do this month. Thank God though. I went to check my PCV today, is 32. Thank God, let me relax. You need to go back again after 2 weeks and check. Like you will always check. So if it's going down, you will start again. In fact, when I did mine, immediately I was going to the hospital and they were always telling me every 2 weeks that my blood, in fact, it was dropping, but every week it was always dropping. So I'm like, okay, I had to use all these things throughout my pregnancy. Though I was going to the hospital every 2 weeks, so even if it's too much, they would detect. You get. So mine was really low then. So, but thank God my baby is alive. I am alive, and I'll be sharing with you my 3 secrets that I did. First off is ugu leaf. I know you'd have heard from north, east, west, south that ugu is good. Me, I'm one of them. I'm testifying to you now that ugu leaf the best. You cannot even, I don't know how you want to do it, but ugu leaf. So how I did mine, when I get ugu from the market, I wash. When I wash it to remove germs and all. In fact, I go extra mile by putting water inside the pot. By boil hot water, I'll just put the leaf inside and remove it immediately. I'm not cooking it, just to kill the germs. You know, it's leaf now in the market, germs everywhere. So I put it inside the hot water, like a blanching, but not a full blanching something. You just put it inside the water and remove the hot water and remove it just to kill the germs. Then what I do next is I blend. After blending, I blend everything, then sieve it out. You pour it into a mesh cloth or muslin cloth or whatever it is. That cloth, yeah, that cloth I used to use to sieve ogi. Yes. So when you pour your already blended ugu into that muslin cloth, you squeeze the juice out. When you squeeze the juice out, then I turn it into a five this thing, 5 liter keg. That's what I do. Then I keep refrigerator, in fact, inside the freezer, because I don't then I'm working, so I don't have time to be blending every morning. So that's what I do. Just I do it for a week. I prepare for a week. So every morning when I'm going to work, I pour it into a cup. In fact, you can use a small cup to measure. As you measure, like maybe you can use just small cup to measure into a big cup. You can measure 3 of that full small cup into a big cup. When you the amount you can swallow or you can finish at a time. Then after measuring that 3 ugu water into a big cup, that same cup you use it to measure fruit juice, orange fruit juice, just one of it. Then you pour it into it. So I'm saying 3:1, 3 cups of ugu leaf and 1 cup of orange juice. Mix it together. Then you see, I did like this. I didn't do it for a reason, because then the smell of that ugu, God Almighty, taste the grace of God. In fact, if you're a pregnant woman and that thing does not make you want to vomit, then you're a strong woman. But as for me, I had time swallowing it. But thanks to that orange juice, it could be orange squeeze juice or all this carton orange juice. Just pour it into it. It will help you reduce the smell. It will reduce the smell so you can consume it. And also, so vitamin C helps in absorption of iron faster. It helps. So the vitamin C is doing 2 things. It helps you in swallowing it easily, and it also helps in the absorption of the iron into your body system. So the vitamin C is just not there. That's the orange juice is not there just for fun or anything. It's actually doing this. In fact, it's very important. Yes, it's very important if you want it to work faster for you. So I take this thing, I take it in the morning only. So I'm telling you my routine. I take this once a day in the morning. How it worked for me. So number 2 that I will be mentioning here is totema. If you want me to attach the picture of the totema in my video, I will do that. I think they spell it TOTHOTEMA or so. I will attach the picture to this video. I'll attach the picture. So totema, that's, in fact, it was my doctor that personally told me, the way you are going, we need to admit you. But you know what? I'm going to advise. And then I don't like blood tonic. Right from time, even before I got pregnant, blood tonic doesn't go well with my tummy. It gives me this stomach pain. I don't really. Me and blood tonic, we're not that close. We don't have a close rapport. So immediately, he told me that maybe you should put me on blood tonic. I told him even when I was not pregnant, I don't really like blood tonic. So he told me this totema is okay for somebody like you. So when I took the totema, I noticed I don't usually have that. My tummy is not always aching me. So totema is good for me. This is what I use. So I use totema at night. I take a good drink in the morning. I use totema at night. So that was one of the things I used though. Ugu in the morning, totema at night. Yes. So it's really, really good. Yes. You can ask your doctor. I'm not saying you should use it. So what I'm saying is you can go to your doctor and ask him that or her that, can you use this totema that you heard totema is good? Just hear the review from your doctor. You know they know better. Me, I'm just telling you what I did. But at least if you can propose it to your doctor and say, okay, go ahead and use it, it's fine. But for that ugu, you don't even need to go to your doctor to ask if you really, your blood level is really low. You don't need to. That one is is not is just leave it. So the third thing I used was ABC ABC drink. What do I mean by ABC drink? ABC drink simply means apple. The A stands for apple, B stands for beetroot, C stands for carrot. Yes, apple, beetroot, and carrot. It's called ABC drink. Yeah, it's actually very good. In fact, I sell ABC drink. In case you want to order from me, I can dispatch to you anywhere in Lagos. ABC drink is very good. Blend the three together, blend it together, sieve out and take the drink. If you know it's not sweet, because sometimes it's not always sweet, you can just buy dates and mix it. Just blend dates just to make it sweet. Pregnant women and their cravings, and I know they will. So you can just blend dates with it and you're good to go. Easy peasy. So I take ugu leaf in the morning, ugu drink, let me put it that way. Ugu drink in the morning, ABC juice afternoon, totema at night. My baby came out looking healthy, pumping, no complications. Fine. And we are good to go. So if you can follow these few steps, at least for the ugu, I can assure you it is okay. But for the totema, please ask your doctors. But me, that is what I use, and it's very good. Ask your doctors for further, explanation about the totema. You get. So it is very good. And ABC, this, if you're not even sure about the totema, or you have a existing blood tonic you are taking already, you can just add ugu drink and ABC juice just to assist the blood tonic to work fast. You get, if you don't want to change your blood tonic. But if you don't even have any blood tonic you use at all, and you don't even know where to start from, you can just take these 3 simple steps and go to your doctor. And mind you, like I said before, I don't know if I said it before, the normal blood volume you are expected to have is 33%. Sometimes you even get to 30 and be stuck for 2 weeks. You'll be like, move now, why you just stuck at 30? You get. So 30 you are getting there, but 33 is the best. 33 is the best. So with all these things, and please always keep your ugu drink refrigerated. If you know you don't have constant light, or you are not, just blend it every day and drink it. Some people don't have to blend, some people have to squeeze safe. If you don't have blender, or your blender is faulty or something, just squeeze it. There's a way you just wash. After washing it, you bring your ugu out and squeeze out the juice, squeeze it out and drink. My dear, your blood will start shooting up and down like this, and your doctors will be like, madam, what did you do? And my mothers, please, just take this thing serious. It is a serious issue. So when I see people asking me what did I do about mine, or telling me they have this low blood something, I'm like, I'm going to do a video about it. You are not alone. Maybe some other people might need, because I already gave one of my friend this and she's fine. In fact, the doctor told her to continue what she's doing, that whatever you're doing, just continue doing it, that is working for you. So I'm like, if this is working for you, this can also work for other people. Let me just share this so people can know. But for the totema, please ask your doctor if you can go about it. But for the ugu and the ABC juice, they are okay. You're good to go. In fact, you can even use it, especially the ABC juice, if you're pregnant, is fruit now, so it will also benefit your body, to benefit the baby. You get. So it's okay, it's fine. So thank you for watching my video. Thank you. Please don't forget to like, subscribe, share with everybody, and I'll be seeing you in my next video. Bye.